All right, good morning, everyone. We're going to help this patient get defined, okay? This morning, she's excited because this has been bothering her a lot, and so we're going to do an abdominoplasty. So let's talk about this particular case. So we often see patients in consultations and, we evaluate them. Are they a good candidate for abdominoplasty? Well, obviously, if you examine this patient, she doesn't have a lot of fat above the muscle. I mean, most of this is from the distension, from the separation in her muscle. So obviously liposuction is not going to do anything. And so what we're going to do is we're going to do a full abdominoplasty. And how we know if the patient is ready is really the amount of fat inside, or the gut fat, or the intra-abdominal fat is what we look at, or the other name is visceral fat. That's the fat that makes everything come out. Now, so it's very important that she does not have a lot of intra-abdominal. So the way to test for that, I mean, obviously she does have some, but the way to test to see if she's ready is I'll have her kind of like engage her muscles. I have her kind of like suck in. Go ahead and do that for me. So when she does that, you can see it comes in, and then I can feel this large separation right here. I mean, it's a huge separation. So this is what I'm going to tie together. It starts right there. I can feel it, and it's a pretty wide separation right there. So we're going to tie all this together, and that's going to make her flatter. And she has a little umbilical hernia, so hopefully that will kind of like shrink in, and we'll take care of that too. It's a tiny little one. And so that's how you know when she's sucking. And then when I feel it's relatively soft, and I can push in, and I can feel the separation. If it's really hard, then the patient has to lose weight, because too much intra-abdominal fat is not going to allow us to tie the muscle tight, and it's just not good. Well, what happens if we do the surgery and she doesn't take care of herself and she decides that she's going to eat whatever she wants? Well, the fat doesn't go away when you lose weight. The fat always stays around in there. They just shrink. They don't die. They shrink. So they're ready to get fatter when we're ready to eat more. So it's very important that you maintain a healthy lifestyle, because if you don't maintain a healthy lifestyle after abdominoplasty, it's not going to work. So I tell patients, the wonderful work that we do here, it's short term. The only one that makes it long term, it's the patient. So it's important to change your lifestyle and do the right things, because if you don't, it's not going to work. It never does. So unless you're ready to do that, then you won't be ready to do surgery. All this right here represent the skin we're going to remove. You can see it's quite a bit. I mean, we're going to skip this whole section out, and I mean, the only stretch mark left are these little guys here, and that's going to come all the way down here. So it's going to be a lot of stretch mark. And you can see, I mean, it's a large section of skin, a large section. So she's going to see a fantastic change. I think she's ready.